Dr. Humayun, I have a question in regards to the density of the transplanted hair. I've watched some of the hair transplant surgeons talking about hair density as high as 50, 60 grafts per centimeter square. Of course, there are standard guidelines, and they say, well, more is better, but then there are standard guidelines. I've heard from my dad, excessive everything is bad. So what's your take on that? What's the recommendation? What's your take on that?
Okay, you see, there is a study which has shown that if we removed 50% of the hair, that means 50% of the grafts, right? More or less. So we will maintain the visual density, the visual, not the true density, right? Now, if let's suppose on an average, in different region, the average is about 100. Most of them are between, if you say 90 to 100. So that means if I go beyond 50, I will not achieve anything because the visual density will remain the same. Now, hair loss is a continuous process. It will continue for the rest of your life. So if I do not know how much he's going to go, even if I predict that it's a slow hair loss, and I want to go beyond 50, I do not see a reason why I should add more if I'm not going to improve the cosmetic density of it. This is a cosmetic procedure, right? So why should we go beyond 50%? So that means now we are there. Now, on the other hand, we have to see the donor area and everything. Now, what I would, in my opinion, you need to understand the other thing. In one go, you cannot touch 50, 60. The reason being is that the safe what you call is the incision, the number of incision you can make it in per square centimeters is 30. That means if you have 1 millimeter of incision, you cannot do more than 30 incisions of 1 millimeter per square centimeters. That's 30 millimeters per square centimeters. Now, if I'm going to go to 50, that means I'm going to go 0.5 millimeter of my blade. That means the only thing that I can implant in that is singles, right? Even for singles, you have to be 0.6, 0.7. And then beyond that, 0.8, 0.9 is doubles and triples, right? So that means I cannot go beyond that thing because otherwise I'm going to risk the necrosis. All in all, if you ask me, I personally do not go beyond 30. And 30, 35 in 2 sessions, not in 1 sessions. So what I do is that I see there is something which is called minimum coverage factor, which is around 6. So that means the diameter in millimeter times the number of hair, right? So if you have got an average diameter, which you have done beforehand, multiply with the number of hair, you would see 6 figure how much it comes. You can calculate how many hair you can do. Now FUE, almost it's about 2 hair per follicle unit when you doing FUE. So now you calculate how many grafts you need. So 6, whatever it is, don't go beyond that. Rather stay a little less, right? If you stay a little less and the patient is happy, he will get the same results for a lesser amount of money that he'll to pay. Yes, if you have a conflict of interest, you want to do bigger surgeries just because you will do the more grafts, you will charge more. That's how I see it. So in my opinion, I would not go beyond 20 grafts per square centimeters in first session. And 90, if not 100, somewhere around 90, 80 to 90% of my patients are very happy with that. They do not need more. They just need more area to be covered, not more density. And then you can, in the second section, you can do what I tell people is strategic placing. That means the way they style, you see which are the weak area, then you put the grafts over their strategic area. Okay?
Thank you.